Hi, I am Kimberly Brown Hilburn, K Brown, and I am going to do the central dressing change. I'm going to go ahead and wash my hands. I wash my hands, and now I'm going to disinfect my, my, um, my tray, which I'm going to be doing the work on. I use disinfectant spray, so I'm going to disinfect my tray here. Okay, I am going to allow the surface to dry, go wash my hands again, and I will be right back. Okay, I'm back. So I washed my hands. I'm going to go ahead and put on my gloves. Okay, so my gloves are here. I'm just going to put on regular nitrile gloves before going to the sterile gloves. So I'm going to ask my patient, I'm going to introduce myself to the patient. This is Daniel Hilburn, and I kind of set up a makeshift central line for him so that we can practice doing the central line dressing change. Daniel, can you please give me your date of birth?
6/8/94.
Okay, 6/8/94. I'm checking his wristband there, and this is Daniel. Identify my patient. This is the correct patient. We're going to do a central dressing change for you today, and I'm going to ask you to put this mask on here. So you put the mask on so that he's not breathing over the location where the central dressing is. So put that on for me. And then I'm going to put my mask on as well. This is the central line kit here. And we're going to take out the sterile gloves, which are here. And we have the bandage here, which I dated for today's date and my initials. We have the alcohol swab. The kit does not have the chlorhexidine patch. So we just have, this is the skin prep. We have some gauze here. And this alcohol swab stick will replace the chlorhexidine. Also, we don't have a chlorhexidine patch to put on there. So this is all we have in the kit. I'm going to put this kit over to the side. The Sure Prep protective wipe, but that's the same as this here. So I'm not quite sure why we have two of these. So now I'm looking at them and I'm looking at the site where I'm going to place the dressing, and I'm trying to identify if there's any signs of infection, any swelling, redness, or any oozing, and it looks good. So I'm going to do the sterile gloves at this time. This over, this over, this over. So I'm removing regular gloves and throw those away. And now I'm just going to put on the sterile gloves. So I'm right-handed. I'm going to glove my right hand first. So okay, so now I have my sterile fill, and I'm going to grab This is the cleaner, chlorhexin. We're gonna go back and forth, cleaning the area for 30 seconds. Vigorously cleaning, make sure it's completely clean. And we're gonna let that air dry while we throw this away. So there's no patch. There's no patch to put on the site. Therefore, I guess I can use this as the chlorhexin patch. And we'll take a piece of gauze and hold the tubing. We'll put the patch on there, and we're going to put it on the 5 o'clock site. And now we're going to put I'm going to start at the top. No, we're not going to do that. What we're going to do is we're going to prepare the skin using the skin prep where we want the dressing to be. So we're going to put it in the window where the dressing is going to be. We want to throw that away. And then we're going to put the dressing. Put the dressing on. And from the top, to the bottom. Oh, that's interesting. Okay. So we don't have another dressing to put underneath, but if we had an anchor dressing, we would anchor the dressing underneath the line there. And we're going to put the date that we changed the dressing with the initials there so that we know when it's time to change the dressing again. Thank you. And now that the dressing is changed, I'm going to go ahead and discard all of my products here into the garbage. So I noticed that our kit did not have certain things. So as I got into it, I started seeing I didn't have the patch and I didn't have the anchor. So that kind of threw me a little bit. But that's the central line adding the dressing. We didn't have a dressing to change. So thank you.